Seroma is a complications that can arise after surgery, characterized by the accumulations of fluid under the skin close to the surgical scar. These accumulations of the fluid is more common after surgeries in which there was curing and manipulations of the skin and fused tissue, such after plastic surgeries such as abdominal plastic, liposuctions, breakfast surgery after cesarean sections, for example, being the result of the inflammations caused by the producers and beauty's defense reactions. When do we consider an aesthetic scar? It is very visible due to its shape or color. It has widened. She is depressed or depressed. The edges are not perfectly approximated and in forms as steep. It elevates compared to normal skin, is hypertrophic and keloid and formed, produce an distortions of some feather on the face.
Wound hematoma formed by accumulation of blood and clots is one of the most common complications and is almost always caused by imperfect hematosis. Patients receiving low dose of acetyl salicylic acid or heparin have a slightly higher risk of developing this complication, but is much higher in those who have been given systemically effective doses of anticoagulants and those with coagulopathies. Vigorous coughing or higher blood pressure immediately after surgery contributes to the formation of a bruises in the wound. Bruising causes elongation and discoloration of the wound edges, discomfort and swelling. Blood sometimes leads to the sutures in the skin. Next, bruising.
Wound infection. Any infection found on the surgical incision site within a period of 30 days after the surgical act or 1 year later if there is an implant. Causes. Microbes harvested on the skin they spread to the surgical wound. Microbes they are in your body or they can come from the organ where the surgical was performed. Wound necrosis. It is a death or skin segments, variable extension and depth, presentation time during the second week or surgery. Prenoti. In superficial necrosis, field sequels, grapes or flaps may have more important staging sequels.
Chronic or non-healing wounds. A chronic wound is defined as a loss of continuity of the epithelial surface, with loss of substance with little or no tendency to subcutaneous healing that requires very long periods for its healing be secondary intention. How to heal wounds that do not heal? Regarding the care required for a wound that takes time to heal, the specialist states that it is advisable to disinfect it with povidone in the morning and at night, apply a healing and antiseptic ointment, and then cover with gauze to keep it protected from friction or damage zone. How is chronic wound treated? 1. Cleaning is done by washing the wound with sterile water. 2. Debridement is done to remove anything from the wound that could delay healing and lead to infection. 3. Wound dressings are used to protect the wound from further injury and infection.
In the area of the surgical wound, an erythematous, hot and fluctuating area is seen in the middle third. It is opened by draining abundant purulent material, and also the antibiotic treatment.